There's a case study from a hospital in New York where a man from who came from a nursing home, who was a mental patient, who actually had a colon that was much larger than that because he didn't go to the bathroom for more than a month. He didn't move his bowels for more than a month, and so it's called a megacolon. And so that's a medical condition that actually does exist. As a colon hydrotherapist, and again, you coming to me for service, I couldn't just look at you and determine that that's what's happening. Those are diagnostic identification, and so you would have to have a medical doctor identify that. But what I like people to understand, what I like the public to understand, is that with a trained therapist, colon hydrotherapy is a safe procedure. I think a lot of times doctors don't truly understand what's happening. They have made an assumption that we're depleting the body by removing all of the healthy organisms, where in fact there are case studies to show that the longer the waste material sits inside the body, the less healthy microorganisms you have. So what we're attempting to do is help educate them. What I always say to clients is that we have literature that we can give you. We have a wonderful brochure that's produced by our association to help educate the doctors. Clients themselves, if they've received a colon hydrotherapy session, they have to sit there and say to their doctor what exactly happened during that session. So the doctor has a different picture. We're members of the association. We have an ambassadors training where we can actually go out and talk to the medical community to help educate them regarding the procedure of colon hydrotherapy so that we can alleviate some of those fears or concerns that they have for their patients. And rightly so, they are concerned. They don't want their patients to be harmed by doing something that they don't quite understand. And they also are not wanting their patients to be going to a practitioner that might be diagnosing or prescribing in lieu of what they would consider appropriate medical treatment. And so our therapists are trained to understand the distinctions between that, to build a relationship with those doctors and help to educate them. So I think a lot of it has to do with education, that once they are, just like the doctors that I talked to you about in Danbury, Connecticut, they first started with using the procedure just to clean the bowel so they could do a colonoscopy, to see the colonoscopy pictures. Then they started using it for more practical applications, other things that they identified they wanted to do with it. And so that's what has to happen. They have to be open to receiving new information.
Are there any disadvantages to getting a colonic?
From my practical application, I don't see a disadvantage at all. I wouldn't call, some of the things that might happen as a result of it, that sometimes people have what we consider cleansing responses or detox reactions where their bodies are throwing off a lot of, having a lot of what we consider untoward responses such as nausea or cramping. I don't consider those are negative. Sometimes those can be a benefit. If you are having, your body is presenting itself in a certain way. If you are one of those people that has lived a standard American life, and so I don't see it as a negative. I can't find anything that I would say would be a negative for the process. I would say that in certain conditions, when you're working with certain groups of patients, and so let's say you're working with certain groups of clients like children, anyone that has a chronic disease process, elderly, that you want, or anybody that has an immune system compromise, that you want to be working with the medical community in conjunction. So an example would be one of our immediate past president, who's now the president emeritus. He's a chiropractor and a naturopath in Washington State. And he is actually working with a young man, a little boy who's about 10 years old, who has autism. And when he first came for the beginning treatments, and the treatments are sanctioned by the medical doctor, because they had had this young child on a ton of medication that was not working, and so they were looking for some other avenue. And so this is now the information is being compiled and hopefully will be presented in a medical journal as a case review. But part of what happened is the young man now, at first when he first started coming, and autism children are, they're kind of shut down emotionally. And so when he first came, he had to be guided in, and the parents had to help him understand what was going to happen, and the therapist had to work, extremely close. Now, extremely close with him to get him to stay on the table and, be able to allow the procedure to take place. Now the young man, the child comes in and grabs the therapist's hand and takes the therapist off to the room to get the procedure done. And that's, from just that kind of progress, from not being connected or not being able to identify what's happening to now being able to at least acknowledge that this is going to happen and it's okay, that's a real progress, I think, for that child. And so the practical application, the medical community is needed in order to be able to identify those applications and be able to say, I will use colon hydrotherapy for this, or I will use colon hydrotherapy for that. Both my husband and I, Dr. Milton Chandler, are certified colon hydrotherapy instructors and national board certified therapists through the IAC Association, the International Association for Colon Hydrotherapy. I currently sit on the board of directors as the president-elect, and beginning October 2011, I will be the president of this international association. So IAC has developed, and has developed for a while, a training program, a curriculum to prepare therapists so that they can provide services to the public safely using FDA registered equipment, and also using disposable equipment. It supports the use of disposable over equipment that you might reuse or autoclave to prepare. It requires that people coming for training have some form of anatomy and physiology preparation. And so IAC is now really encouraging its therapists to become more grounded in anatomy and physiology. Not at the medical level where you have to, know it as well as a nurse or a doctor might, but at some level so that you really understand how the organs are working. The other part of it is that our students get educated as far as business, licensing for their business establishment. They get grounded in the theory and practice. They understand when colon therapy is indicated, when it is contraindicated. They learn a little bit about different medications that clients may be on and how to, interact with those clients. They learn to interact with the medical community, getting prescriptions for services when those prescriptions are necessary.
When you say prescriptions, what are you referring to with prescriptions?
Well, the colon hydrotherapy units that are FDA registered are classified as a Class II medical device. And its classification states that it needs to have a prescription for use. Principally, it's used for colonoscopy or diagnostic preparation to get the colon prepared for visualization by the medical doctor. So when we are seeing clients, we are encouraged by our professional association to have a relationship with that client's physician so that we know from a safety perspective that they've been seen by someone else. We don't have the capacity, or it's not within our scope of practice, to diagnose or prescribe, and so we want to make sure that everyone who's coming in can safely receive a session. And so that's part of what we teach.
Any encouraging words or closing thoughts that you would like to share with us about colon therapy and anything else?
The one thing I think I want to leave with the audience, both the general public and the medical community, is I had to relearn anatomy and physiology when I became a colon hydrotherapist. I have obviously learned it A&P well enough to work as an RN for a while, but when I became a colon hydrotherapist, I wanted to understand exactly what was happening in the body. And so I'm really, really appreciative of that. I encourage everybody to learn more about how your body works, how health works, in order to make sure that you have the quality of life that you want. You know, how we eat and how we live our lives and how we think really determine what kind of quality of life we're going to have. And all of us, you know, especially as baby boomers, want to be vibrant and highly functional during our, you know, years as we age. And so one of the ways you do that is you pay attention to your body. You know, your body talks to you, listen. Therapists are out in the field coming from different walks of life. Some of them have gone to the manufacturer and received device training only, so they know how to operate the device and have kind of learned on the job. Other therapists are using other types of equipment and they've also learned on the job. They may have certifications in other areas such as herbs or nutrition, and they've kind of come to know colon therapy from that arena. IAC is the one nonprofit organization that has provided a structured curriculum and training for people wanting to enter the colon hydrotherapy industry. So I would say to the public, please look for FDA registered equipment. Please look that your therapist is using disposables, and if they're not using disposables, that they can show that they're reusable, they're autoclavable instrument has been autoclaved properly, and that their autoclave is being checked by a biomechanical engineer several times a year. I'd also want to see what are some of the other certifications that they might hold with some of the information that they're giving me. If they're talking to me about nutrition or they're talking to me about other aspects of wellness, what other certifications might they hold to support that? What their environment looks like. That would be the other place. Many therapists work from a variety of locations. Some have home-based businesses. Some have businesses in a commercial establishment. So you would look the same way you would look for if you were having people come over for dinner. You know, how is your place set up, and how clean is it, and you know, how does the therapist speak with you and approach you? Do they just have you come in and go right to the colon therapy session, or do they spend time in educating you on the digestive tract? Do you fill out a health intake form, giving them a little bit of information about you and talking to them about some of the things that might be happening with you, or do they not take any of that information? So those are some of the things that I would use if I was seeking services from a professional colon therapist.